Hi, today I want to go over something very important, the difference between a hip joint and the lower back. Now, a lot of people get the hip joint very confused. They say, my hip is hurting me, and they're pointing down to the lower back area, back where the sacrum is. I wanted to show you a couple things here, just so you understand. Very short and simple video here. The lower part of the lower back, you remember you're supposed to have a lordosis in the lower back, and the mid-back a kyphosis, and in the neck a lordosis. Kind of looks like a S-shaped curve from the side. From the front it should be straight. Otherwise that would be called a scoliosis. So we're talking about the hip joint. The hip joint is located on the side of your upper thigh area. That means that it's not in the lower back here. So if you're pushing back here, my hip is hurting me, that's not your hip. Your hip joint is made up of a head called from the femur that goes into the acetabular area. And what happens is when this joint becomes inflamed and irritated as a result of improper balance of the pelvis, because the pelvis, called the sacroiliac joint back here, can rotate. One can sit up higher or lower depending upon many factors. Bad posture, sitting, lifting incorrectly, just doing things incorrectly, excessive weight bearing, weakness of the ligaments, weak core. Bottom line is, when this pelvic comes off, you're going to have more weight on one side of the body than the other, and it's going to affect the hip joint, causing more wear and tear, more degeneration, and potentially can be something more serious in the future. So I want you to understand that the pelvic is very important for symmetry and balance. The hip joint is off to the side, and people that spend a lot of time sitting in a crunch position with your legs up, that hip joint can go into contracture. The muscles, the iliopsoas muscles, the hip flexors can shorten, can contract, and cause lots of distress as well. Leave your questions below if you have any. Most important, today as well as every other day, make it a great day. I'm Dr. Alan Mandell.